like to take a little time just to say Happy New Year.
Happy New Year.
And as Tom said, we will push forward in making sure more and more African American men, more and more men are aware of the need for participation in clinical trials. So when we start out our clinical trials update, I always like to identify terminology that in this clinical trial or clinical trials in this area that you may come across. Some of the words are huge. You may not understand the definition behind it. So our objective is to really break it down. So when you leave, you have a good understanding of what these terms mean in relationship to a clinical trial. So in the trial that we'll be talking about today, there's an area of DNA damage. And this is a key point because if there's DNA damage, it may be difficult for the cells to survive. And there are pathways, 4 different pathways that play a role in repairing DNA inside the cells. So to backtrack a little bit, all cells of our body are composed of DNA. All cells of our body has a DNA molecule that it's elliptical. It loops upon itself. And I'll show you an image of that when we move to the next slide. Now, what you'll hear about are these alterations in the DNA repair pathway that may allow new therapies to be developed. A key point, you may hear BRCA2, BRCA1, ATM. These are just abbreviations of common abnormalities that exist inside the DNA. But just remember, BR, breast, CA, cancer. There's always a code, and there's always a way for you to remember breast cancer gene 2, breast cancer gene 1, ATM, just like your ATM machine. Now, homologous recombination deficiency, just a word to say double-stranded breaks. So DNA is a helix, and if you have cracks or breaks in the DNA, in both strands of the DNA, that's what they're talking about here, homologous. Double-stranded breaks on both sides of the DNA. This is responsible for genetic or impacts genetic stability. In this case, breaks cause instability, and they're very dangerous from the standpoint of the cell. Now, important protein, poly ADP ribose polymerase, or PARP. That's just the name. So when you hear people talk about this clinical trial, you'll hear the term PARP. And this protein is important because it helps repair the fractures, the breaks in DNA. So it repairs the DNA, it increases stability of the DNA, and it also plays a role in programmed cell death. Just the way to talk about that is, if a cell has a damaged DNA, it can be triggered to go down a path to die. Now remember this concept, damaged DNA, cell death. So if you can keep it in a cell, if you can keep it damaged, then it's more likely that the cell is going to die. So this is a concept that they're going to exploit. And PARP inhibitors, niraparib, is one of them. Now, this PARP inhibitor just stops the PARP protein from repairing DNA. And as I said earlier, this is an example of a cartoon of DNA. Double helix, 2 loops, or 2 strands. And if you have a break in the strand caused by environmental factors like radiation and chemicals, and under normal conditions, even as a cell divides or with age, you can have damaged DNA. You've heard about chemotherapy when people lose hair after chemotherapy. That's because there's DNA damage. And there's radiotherapy that can cause DNA damage. And the take-home message here, there are 4 pathways, but if you look, PARP pathway is in one of these pathways. But there are 4 different pathways with different categories of particular markers, anti-target, anti-cancer areas. But we're starting here. There will be opportunities for drug development and clinical trials with drugs in this particular space. So, niraparib. It's a class, it's a PARP inhibitor. The organization is the Janssen Pharmaceuticals. Now, what's exciting about this drug is this. It's already been FDA approved for ovarian, fallopian tube, and primary peritoneal cancers. But recently, Janssen was granted breakthrough therapy designation. Now, that's important because it allows Janssen to fast track this drug. We know it works when it comes to women and female cancers, ovarian. Now we can fast track, they're able to fast track this into an area if you have a genetic abnormality with BRCA1 and 2 genes. This therapy may work extremely well for you. So remember, we're fighting cancer and we developed a fight tool. And this fight tool is important because it basically allows you to come to our website, wherever you are, once you have a diagnosis. Is it a high-risk prostate cancer? Is it low risk? Is it recurrent? Or did you have surgery or radiation? Is it localized but resistant? Or is it metastatic, meaning it's moved away from the prostate? We're going to focus on clinical trials that impacts or used to treat metastatic castration-resistant prostate cancer. The GALAHAD, and this is very exciting because it's a PARP inhibitor. It's using a drug that prevents the cancer cell from repairing its DNA. Now, as I said earlier, niraparib in this clinical trial, focuses on patients that have metastatic castration-resistant prostate cancer, but also have the DNA repair anomalies, these breaks in the DNA. And this is the PO medication. And again, you'll see terms like DRD, which is basically DNA repair genetic defects. So in this clinical trial, you must be metastatic castration-resistant, and you must also have a DRD. And this is the list of other DRDs, or genetic anomalies, that this clinical trial will support. The endpoints, no evidence of bone progression. They're looking for a decreased circulation of tumor cells. And they're also looking at a decrease in your prostate, your PSA levels. Clinical trials located in the Boston area, Mass General, New York, Sloan Kettering, North Carolina, Duke Cancer Center. Now, there are other cities throughout the other clinical locations throughout the United States. So you would have to go to the fight tool, pull up the summary, or you can go to clinicaltrial.gov. Now, what was exciting about it is that they did a specified interim analysis, and they just took a look at how the clinical trial was going. And GALAHAD demonstrated that clinical activity in the patients was very successful, especially with recurrent disease. And this biallelic is basically the same thing. You have the BRCA on both of the strands of DNA. So, for more information, you can go to phentrials.com. If you want to email me or call me, we can talk about it. And thank you again, and have a happy new year.